Hello, everybody. My name is Kyle King. I am, let me back up. My name is Kyle King. I'm a second-year medical student at Yale University. I'm an IOCDF Advocate, and I'm the host of the Research Roundtable, and welcome to the IOCDS Research Roundtable, the live stream where we pick a topic in the OCD literature and discuss it with the folks that know it best. As you can probably tell from my cough and stutter in the beginning of this stream, I'm a little under the weather, but don't fear, I'm still here. Unfortunately, though, I don't think my co-host is here yet. I think he's handling something with a grad student. So when John Abramowitz gets back, I'll have him introduce himself very briefly. But no worries, we have a lot of guests this program that we can go ahead and start introducing. Today, we're going to be talking about hoarding disorder. This is the second time we've talked about hoarding disorder, which means that we've covered like a lot of general basic information about hoarding. In a previous video, we'll cover that again a little bit, maybe a little bit more peripherally. And then I kind of want to dig into more deeper research topics with some of our researchers and clinicians on the panel today. Before I introduce them, though, there are a couple things that I have to say. First, this live stream is educational and is not intended to replace therapy. For treatment-related questions, please work with your provider or contact a local clinician. You can use the IOCDS online resource directory at iocdf.org/find help to locate a trained clinician near you. Also, the IOCDF is not a crisis hotline. If you're in a crisis, if you're ever feeling suicidal or unsafe, please call the 988 Suicide and Crisis Lifeline by dialing 988. You can also access this online at www.988lifeline.org or go to a local emergency room or call 911. Also, I say this at the beginning of every stream. This is live. We want to create a safe space for everyone to ask their questions, especially if you have questions about hoarding disorder, or if you want to ask a specific panelist a specific question about their specific research. Please feel free to do so in the chat. Just know that everything that you say in the chat lives on the internet forever. So just be mindful of that, although we've never had any particular problems. Is there anything else that I need to say? I don't believe so. So while we wait for John, I'll go ahead and start introducing our guests. I'll start with Ines Kartal. Ines is a third-year PhD student at Anjali Ruskin University in the, I don't know if I said that right, but Angelia Ruskin University in the UK.
Angliask.
Okay, yeah, close enough. Focusing on hoarding behaviors in young adults, particularly those with attention deficit hyperactivity disorder. Using empirical methods, he examines how young adults make decisions about discarding and organizing their possessions, as well as the cognitive and emotional factors that influence these behaviors. So if you have questions about younger generations and hoarding, he's going to be our guy. Trained as a psychological counselor, he aims to develop early interventions for hoarding behaviors following his PhD. We talked about my silly questions as an icebreaker, so I'm going to start with you for my silly question. I was thinking about Thanksgiving, which is what we're going to be celebrating in the U.S. here in a couple of weeks. And I was thinking about mashed potatoes as a side. So for an international question, what is your favorite way to eat a potato?
This is hard. This is difficult. I'm going to go with fries. Next to fish in the UK.
Next to fish, I strongly disagree with the placement next to fish, but I agree with fried potatoes.
Yeah.
John, do you want to just say a word about yourself real quick?
Sure. Sorry, I was on a kind of a quick emergency call, but I think we got things wrapped up. This is what happens in the life of a psychologist sometimes, a mental health professional. I'm John Abramowitz. I am a clinical psychologist and professor at the University of North Carolina at Chapel Hill. And I'm pleased to be here. And let's get back on with the show, Kyle. Sorry.
Cool. No worries. Our second guest is Dante Lenninger. He's a clinical psychologist working in the specialized OCD and related disorders clinic in Stockholm, Sweden. He's affiliated with the Karolinska Institute, which is a friendly institute to this show. I feel like we have a Karolinska Instituter on about once every other episode. A medical university in Stockholm where he develops and evaluates a support program for relatives of individuals with hoarding disorder. An associate professor is Valin Einov's research team. I hope I nailed that. Dante, same question to you. Favorite way to eat potato? Give me a Swedish version.
I'm going to go with potato chips.
Okay. Honestly, I forgot that that's a way that potatoes could be eaten. But fair enough. Our third guest, Amanda Bellinger. is a fourth-year doctoral student working in Chiara Timpano at the University of Miami. Go Canes! She earned her BS in Psychology and French Language and Literature from Fordham University in 2019. Wow, you must be really grateful that you're not in New York weather right now. Her research interests involve examining mechanisms and maintenance of hoarding disorder with a goal of improving treatment outcomes. Specifically, Amanda is interested in understanding how individuals with hoarding learn over the course of treatment and how this learning may be shaped by emotional responses to sorting. She is also passionate about understanding cultural and developmental factors that influence the manifestation of hoarding symptoms. Amanda, potatoes.
I love mashed potatoes in any form, so I love this question.
I never heard of someone say mashed potatoes in any form. Like
Yes.
Frozen mashed potatoes. I guess, yeah, frozen mashed potatoes.
Well, I'm thinking more like garlic mashed potatoes, cheesy mashed potatoes.
Oh, they are all
any way you want to zhuzh it up. I'm about it.
all phenomenal. Our final guest is Nicole Mack. Nicole is an associate mental health counselor at the San Francisco Center for Compassion-Focused Therapy. She earned her master's degree in mental health counseling from Northwestern University. Nicole works directly with individuals with hoarding and OCD as well as their loved ones. Her primary interests involve treatment advocacy and advancing research in hoarding disorder. Nicole, you asked what question I was going to ask, and you have the most time to think about it. What's your favorite way to eat a potato?
It's funny because I immediately was like, I know this answer. It's going to be hash browns.
Oh, okay. I think from McDonald's?
Ooh, yeah. Those ones are the ones from Dunkin'.
I prefer McDonald's to Dunkin'. You can put it in the chat if you agree with me. Okay, enough silliness. Let's talk about hoarding. So whenever we talk about something that's not OCD, I like to just start with a very broad question that normally derails us for a little while. So that very broad question is going to be, what is hoarding disorder? What defines it? And that's to anyone who wants to answer.
I can start.
There we go.
So hoarding disorder is a mental health condition where people generally struggle with discarding their possessions, and this difficulty discarding generally is caused by strong attachment to the items and strong urge to save items, and this difficulty discarding generally results in clutter that prevents daily functioning, where people can't use their kitchens or their living spaces, their bathrooms, because there are many possessions in these spaces. But this is kind of a disorder, this is kind of a spectrum. In this spectrum, we see different level of severity, different level of clutter. And in some cases, we know that behaviors start much earlier in younger people, but clutter might build up with age. And in severe cases, we call it hoarding disorder. But in other cases, sometimes we call it hoarding behaviors or excessive attachment or difficulty discarding.
Okay. And is there, I'm going to pick on Nicole for this question. Ina's kind of alluded to this, but is it dependent to a degree on the objective accumulation of stuff, or is hoarding disorder defined more by the relationship to the stuff?
Yeah, so I would definitely say it's more like the relationship to the things. When you say, I guess maybe I need to clarify what objective relationship to stuff means, but the kinds of things that people can collect can really range. And a big differentiator is that it tends to just be very disorganized, lots of things in places that maybe don't make sense, things that other people might not value whatsoever. It could even be things that are really valuable, but they're just strewn about. And it can really get to a point where it starts to become just part of the background. Even if you have things that are maybe waist deep and you have a path, it can just objectively feel this is, just how my house has always been, because it's a behavior that's been present in some form of severity for potentially a very long time.
And Amanda and Dante, I want to give you a chance to jump in if you have thoughts.
I think the one thing that I'll add is one of the areas where I am really interested in is the idea of the objective level of clutter kind of being critical for a DSM-5 diagnosis of hoarding. So As Ennis pointed out, oftentimes these behaviors start really young, and people have significant difficulties with discarding items, and it might be causing them a lot of distress. But if the clutter hasn't risen to the point where it's actually impeding their ability to use their home, then unfortunately they don't meet criteria for a diagnosis and might not be able to receive services. So I think that that's one of the areas where we need to understand a little bit better how hoarding develops and how to start intervening so that we can prevent some of the accumulation of clutter and also make sure we get kind of timely intervention for people.
So Kyle, could you repeat the question for me? Wow.
Yeah, super basic. Like, is there anything else you would add to kind of this general conception of what is hoarding disorder if someone on the stream has never heard of it?
Yeah, for sure. So what we could add, of course, which is outside the criterion DSM, is the acquiring part of hoarding disorder, which is not necessary for a diagnosis. There are people that meet criteria and could benefit from treatment that doesn't have this excessive acquiring, but it's still a very, very common feature.
What do you mean by the acquiring part?
Yeah, so basically that more objects, you take in more objects into the home. You either buy it could be from secondhand, it could be from auctions, it could also be things that are free or whatever, so that you have a great influx of objects into the home.
I guess I kind of always assumed that was part of the condition itself. So could you kind of paint a picture of what it would be without acquiring?
Yeah.
Or is this what kind of Nicole was talking about when she said more just strewn about rather than a number of things?
Yeah, you can also have acquired things that you have gotten long ago. Let's say from a family home or something, or you have downsized maybe even.
Okay.
But I think a common thing is things you have inherited at some point. And you can still have difficulties to discard things even though you're not taking in new object into the home. But the most common is that you have, of course.
Are there important differences in terms of treatment or anything else between folks that it's more about just kind of general saving versus people who go out and spend a lot of time acquiring?
Should I start and maybe someone else can? Yeah, so if you are acquiring new object, of course it would be important to stop that first, because else what you're doing in the treatment is not going to have a big benefit. So you would start there probably, and usually that could be maybe a bit easier as well. But otherwise, when it comes to the discarding, it can be the same way. You can add some components of exposure to the sense of the impulse to buy things. Yeah, so maybe I could leave a word for someone else to continue.
So yeah, around like 80% of people with hoarding acquire things. So it's pretty common. And in the most treatment, as Dante said, like generally it's advised to start with acquisition because it's easier to intervene, and with the exposure, it's easier to get some success. And when you get success, you can go to like discarding and clutter level. So generally the treatment plan works like in general terms like this. But folks who don't acquire treatment, like they can start with difficulty discarding and what the items means for them, and maybe some organization skills and other parts, whatever area they are struggling. But like around 80% of people with hoarding acquire things.
Okay.
And could you talk a little bit about like an exposure for, I guess, like activating the impulse to acquire and then not acquiring?
Are you asking me or Ines?
Anyone.
Jump in.
Yeah, so for instance, maybe an easier exposure could be just watching like ads on auction sites but that is in like your field of interest. But you can also go on shopping tours, but of course not shop. That would be the aim of it. Yeah,
I agree.
Okay.
And those things can be, you know, like it becomes increasingly difficult if you think of like apps and like, oh, being on Amazon or being on like TikTok and getting an ad, like those can all be like, oh, this impulse of, you know, I really want it. I would look so good in it. And like being able to like, yeah, like work with the person and like explore like what is that urge, what's coming on, or if you had a tough day, like what's the source of wanting to acquire more or even free things.
So we call it exposure. It's not like, or maybe it is. You guys know, it's not like extinguishing a fear, like something bad's going to happen, or is it? It sounds like the way you're describing it is more kind of learning, like impulse control.
In contrast to OCD or anxiety, like in OCD and anxiety, you're exposed to negative emotion like anxiety, fear. But in the like acquisition things, we are exposing like positive emotions, because like when people see items, they feel like joy. They imagine like, if I have these items, it would be wonderful. My life will be amazing. So this like intense joy they experience. And in the exposure, like acquisition exposure, we call it like non-shopping trips. So they go places and they see items, they feel these emotions, but they are not acquiring. So in this case, it's like the positive emotion.
Mm-hmm.
Got it.
And
I think
that is, oh, sorry.
Sorry, I was just going to say that I think that that's one of the areas where hoarding treatment is really tricky, because not only does acquiring and saving involve the sort of avoidance of negative emotions, but it also increases positive emotions with the acquiring and even with saving, right? When we are surrounded by things that we enjoy, or if we're sorting through things and we're having positive memories come up, you know, there's not just negative emotions that we can, you know, go through fear extinction for. There's also these more positive emotions that come up in both the acquiring and the sorting.
John, or for anyone on the panel, like, how is that different than the positive emotion that I get when I don't touch an object that I feel is contaminated?
Well, that's, and I'll let our panelists, I was going to say, that's an escape, right? That's escape avoidance, right? So that is negatively reinforced because you're escaping a negative, experience. And I'll let the panel speak for themselves, but it sounds like, at least what Amanda is saying, is that there's a positive, or maybe it was, and it's when you collect something, that actually is a different process, and it's more of a positive, like, oh, I feel good because I got this. It's not a relief from, oh, I'm not going to get contaminated. It's more like, oh, I like having my things. But I don't know. I'm a hoarding expert here. You guys are.
Yeah, definitely, I agree. I'm not an OCD expert as well, but I guess in the OCD, it's more like escaping from this negative emotion, negative like perceived outcome. But in the hoarding, it's like the more positively driven emotions and behaviors. And it might be attached to identity as well. Like, if I get this item and I can do things with items, and it, like, I'm a crafty person, so I like doing things. I can do with things, different things. I can build things. I can do other things. So there are lots of opportunities with people, like folks with hoarding disorder. So when they see an item, there are lots of ideas coming up. So I can do these things, and other things. So with all these ideas, it's easier to buy the item rather than just moving away. So in the exposure, it's kind of exposing with these items, but not acquiring, going with the emotion.
Yeah, it's usually like, so when I think of like OCD, maybe like acquiring something because you've contaminated it, or avoiding those things because, some fear could happen and you're trying to avoid that happening. With folks who struggle with hoarding, it's often like these objects represent, as Ines said, like a multitude of identities, ideas, meanings. maybe even, folks who have hoarding, like they feel overly responsible for things. So if something is free, then they're like, I'm going to take all of them because I could use it for something. But that idea never, or almost never, actually pans out. And it kind of just becomes one of a bunch of other objects that have similar ideas. And that becomes in and of itself so overwhelming that, they just get abandoned somewhere in the house.
So, if I'm trying to kind of create a schema of what hoarding disorder is in my head, and like I'm imagining it as kind of like an equation of flux almost, where like you have a person and they have a bunch of stuff in their house, let's say, or in whatever their living space is, and the inability to discard is what really defines the disorder. And then in 80% of cases, there's also this influx that is not necessarily part of the definition, but is something that typically happens. Is that right?
Yeah.
And then
I'm sorry. Continue, Kyle, please.
No. Please add on.
No.
I'm just trying to.
Because one thing that I thought about what John said about the escape and avoidance, sometimes acquired, at least anecdotally, I've heard from people with hoarding disorder that they acquire more things when they are down, then they feel sad or anxious. So in that way, it has both of this kind of negative enforcement and you have a positive enforcement. And then it's kind of clinically difficult to know what is the most valuable one.
Yeah. And that's, in my limited experience working with folks with hoarding, I find that makes it especially challenging for treatment, because you've got two mechanisms that are kind of keeping this behavior in play, as opposed to an OCD you have primarily one. It's negative reinforcement. I don't know.
Yeah.
That makes sense.
I guess for Amanda and Nicole, that is a really interesting addition, that there's if this is the person, this is the influx, there's two mechanisms maintaining influx, there's two mechanisms preventing efflux. Amanda and Nicole, could you talk a little bit more about what are the reasons or the psychological processes that underlie being unable to get rid of stuff? Why do people hold on to things?
I think there's a lot of different reasons in it, and this is another reason why it's difficult with treatment, is because each individual person has their own motivations for why they're keeping things. On one hand, as Nicole mentioned, when we accumulate a lot of things, it becomes so overwhelming to even think about approaching going through and getting rid of, sorting through things. And so there can be a general avoidance of even approaching the task, whether it's because it's anxiety inducing, because it feels like we don't have the sort of organizational capabilities to be able to organize the things. And then I think the other really important piece is this really deep, strong emotional attachment to possessions, to objects, where it feels like, getting rid of something is like ripping a piece of ourselves out, or letting go of a part of our identity, or a memory that's really important to us. And so it can feel not only overwhelming to just approach in general, but then when people do start the sorting and they're saying, I'm not going to avoid, I'm going to do the sorting, there's a lot of really strong negative feelings that are really aversive and really, we don't want to experience them. So that can also lead to not wanting to get rid of the things when we do sort.
Yeah, and I would add that, in addition to it being very emotionally, a turbulent kind of experience, it also can be incredibly shameful. To address all of your possessions, some of these things can, not seem very valuable to other people. And for someone who's not experiencing the problem, it might just be just get rid of it, we'll find someone who can throw it all out. And that can bring on a lot of shame and, that's really hard to deal with, and to feel like, oh, must be something wrong with me because I'm having so much trouble with this. And I think that's a huge motivator, or a huge reason that a lot of people struggle with this and don't talk about it. It's really easy, because if you never let someone into your home or into your car or your office, they won't necessarily know. And I think that's a really big reason too, because it's very difficult, and it's going to be a long process to be like getting rid of objects.
And to what degree do folks with hoarding disorder have, I guess, insight into the reason that they're holding on to things? And then I suppose, I don't mean to be terribly reductionist, but like, let's say the underlying fear is if I throw this out, I'll lose a part of myself. Insight into, maybe that thought isn't 100% true, and how can we work on that? I'm sure there's a spectrum, but
yeah,
So
I think oh, sorry.
Please go ahead.
Ines.
Go ahead. I can go after you. Please go.
Yeah, so I think you're right that there is going to be a wide range of insight. And as you said, it could be that it's difficult to discard it because it feels like a part of your identity, but it could also be that it has a value in some other way, a sentimental value or a practical value. And if we look at every object in itself, it could be the right decision to keep it. And it can only becomes the wrong decision if you kind of zoom out and you kind of put it in the light of all the other things you have at home that could also be a value. So I think that is also, it's not only the object, the value in itself, but also in the context of
what you already have.
Yeah.
Yeah, related to the question about insight. So insight is a specifier in DSM-5. So we have folks with really poor insight. We have folks with relatively good insight. So insight is a thing in hoarding as well, because we have many people with hoarding disorder who are not aware of the problem. So they just see the things as normal. So they don't see the clutter, all this difficulty discarding and acquisition as a problem. But the thing is, their family members see it. Their family member is affected by these ones, and there's a lot of dispute over this clutter, before they come to clinic. And some people call it love and fury discussion, because they love the person with the hoarding disorder, but also family members struggle with the clutter as well. So with related to this insight, there are some family conflict as well, which is important for clinical interventions as well. So insight is a big thing in hoarding, and when it comes to treatment. So without insight, without the motivation, it's really hard to change the behavior. And in most of the treatment models, they have motivational interview, which is kind of teaching person about the things they are struggling and increasing the motivation for the treatment.
I want to switch into treatment questions, then talk a little bit about the difference between OCD and hoarding disorder, but there are some questions in the chat that I want to get to. So Musia at 1214 asked, is it common to use hoarding as a comfort, as a replacement for people when someone has fear of abandonment issues? And then we recently got a comment from Dr. Ikra around the same thing, is the disorder related to our emotional attachment?
So there's some really interesting work on the role of emotional attachment and interpersonal attachment in hoarding disorder. I think that Jess Grisham's lab does in Australia. And one of the things that they talk about is that people who have hoarding might have some interpersonal difficulties or attachment to people difficulties with that. And that can lead them to turn to objects as a source of emotional attachment and connection. And ultimately, kind of what happens is that doesn't fully satisfy that need to have relationships with people. And so because that is never actually fully met by objects, that leads to more and more accumulation. And unfortunately, the really negative side effect is that then that also drives a wedge even more between your interpersonal relationships. So when you have a lot of clutter, it can lead to a lot of discord in family relationships, as I know other panelists can speak to as well.
That's really interesting because, right, it becomes a vicious cycle.
Yeah.
Huh.
And I also want to say too that, like, this draw to objects over like people, that's also can be very similar to how, even folks who, don't experience like a clinical level of hoarding can also treat objects. So maybe like, retail therapy, in the time of like, mass uncertainty, like wanting to stockpile on things, like objects can give you comfort or relief in a way that maybe, like a connection might not. And just for hoarding, that has a much more like pervasive kind of experience for them.
Sorry, Amanda, the lab that you referenced, is it that they're investigating this connection between interpersonal relationships and or rejection and hoarding, or is it more they've kind of already established a connection and they're building from it? Like what is the current state of that research?
So as far as I am aware, so they had some papers come out about interpersonal attachment in people with hoarding. They've talked a little bit about like what the role object attachment might play in that. And then they also recently came out with, and it's something that we collaborated with in Chiara Timpano's lab, looking at loneliness and an intervention for loneliness in people who have hoarding. And so if we can build up some of this interpersonal connection, can that help with hoarding symptoms? So I think that's still kind of an area where they're exploring how can we bolster people and interpersonal connections to improve outcomes for people.
Has there been research on social anxiety and hoarding?
I'm not 100% sure. I don't know if the other panelists have thoughts.
I feel like
There is some research on social isolation and social conflicts, or like social support, and we know like people who hoard have like low social support even than people with OCD. So social support and social isolation is important, but in terms of social anxiety, there isn't much research as far as I'm aware, but it's another thing to look for.
And I guess it would be hard to tease out, and maybe it's a reciprocal relationship, what comes first, right? Is it the social isolation that leads to hoarding? Is it the hoarding leads to social? It sounds like what you guys are saying is it's kind of working both ways, unfortunately.
Yeah, it is really difficult to entangle, as you said. Like we don't have like longitudinal data to suggest some causality, and like people with hoarding disorder, like we have a higher number of like comorbidity with depression as well, and how depression plays a role in this social isolation or social anxiety, as you said. So it's another thing to, I think, explore a bit further.
Yeah, but definitely statistically complicated to parse out. What is the natural life course of hoarding disorder typically? Like when do the symptoms begin? When do they peak typically?
So I work with younger people, so I can just start with that question. So in the clinic, like firstly, we have seen like many older people who are seeking help. So at the first, it was thought like it's a kind of phenomenon in older adults, but research has shown after that, like first initial theoretical studies, research has shown that like hoarding behavior starts much earlier, like late adolescence, early adulthood, and it progresses every 5 years. So it starts in like late adolescence, and every stage of life it builds up, like with the clutter and with maybe acquisition and with the emotional attachment, and it gets like worse over the time.
Interesting.
And there's also been some research where like trauma can play a big role in it. So, someone may not present as having like very serious hoarding issues, and then suddenly some traumatic thing happens, and then that, just their severity just like skyrockets. So it has a lot of presentations.
Mm-hmm. Yeah, I think this connection to social relationships, Nicole, as you mentioned, this like I would say just humanistic impulse where like objects can feel good sometimes, and then blowing that up to a disordered magnitude. It's definitely multifactorial and very complicated. I'm still trying to establish like a simplified model in my head, and it's not going super well. John, real quick, break for an OCD question, because we probably have a lot of folks with OCD also watching. Is there a lot of research on social isolation in OCD? Like, is that also a mechanism at play in OCD?
It can be, but we know that lots of folks with OCD are in relationships, and so I would imagine that it's not as big of OCD is not necessarily as big of a hindrance to social interactions as hoarding might be, just because.
So like this conversation sounds different if we were having this about OCD versus about hoarding disorder.
I think it does. Yeah, I think that it does. And just the dynamics are different, because in OCD, when people are in relationships, often what's happening is that the person with OCD is looking for reassurance, looking for anxiety reduction. So they end up kind of pulling in people, in their midst, family members, things like that, friends, partners, to kind of help with anxiety reduction. And my guess, and again, we have the experts here, is that in hoarding, there's probably more kind of, I got this, I don't want you involved, I'm embarrassed by this, and almost trying to hide it.
Experts.
I don't know, guys. Am I making any sense at all?
I think that you're right in that accommodation would look different and probably be less clear than in OCD, but still you would have relatives that store items for a person with hoarding disorder in their home, or pay for storages, or have like communal spaces in the home that kind of gets occupied by the clutter. But as you said, this kind of trying to push the person to change, push the person with hoarding to make a change is probably more prevalent, and probably leads to more conflicts at least in another way than in OCD. That would be my guess.
Yeah, I agree with you, John, that like the working heuristic in my head is that there's probably some degree of pushing away, but that's a really interesting point, Dante, that like there is accommodation still in hoarding disorder. And
I didn't think of that.
I didn't think of that either. And so I guess while we're talking about it, and this is something we talked about before, and then I want to get to an audience question. There's a lot of things to do. What typically are the family dynamics? You talked a little bit about families being pushed away, but like, I guess my first question is like, if you're a child growing up in the home of someone who is hoarding, does that lead to an increased likelihood of developing hoarding disorder? How does that play out typically? Oh, grab my pen.
I do know that there's a genetic component for hoarding. So, it's a little bit of that, like, is it okay, you're already predisposed and you're also in an environment that, has like lots of objects and that feels normal. Or, is it only the environment? Who's to say? Maybe the more research savvy folks will know. But yeah, I mean, the research that I have read is that there's, a lot of conflict with it. There's a lot of tension around wanting to try to push the person who struggles with hoarding to change their behaviors, conflict about like keeping objects and the resistance that an adult parent would have that, can feel very abandoning for someone who's, that's their parent and we're fighting about whether to keep, XYZ thing. It can lead to a lot of estrangement, unfortunately. And yeah, I think that that's like a very big part of, the parent-child relationship.
Does anyone else want to kind of just expand on?
When you say there's a genetic component, are there studies? Like what does the literature say?
There are studies, and I am sorry that I can't recall a particular author, but yeah, there are studies that say that hoarding disorder is very highly genetic, and I think it might be even more so than OCD. I see some nodding, so it seems like other folks can also agree.
Yeah, please, if anyone does know, I'd love to hear about it.
I can't recall off the top of my head what the like percent heritability is, or like what, but they've done research in like twin studies and within families, and yes, that there is a high genetic loading, and it is heritable.
Interesting.
Okay, Stacy has a question in the chat, and I want to get to it, and I think it's a good segue into treatment. Stacy has at 12:36. How do you fight the fear and anxiety that comes with facing a pile of hoarded stuff? How do you start to declutter it if you're afraid of the consequences of throwing valuable things away? So I guess the broader question here is, how do you treat this thing?
It's a 1 million question.
Yeah. When I was looking online, I saw there's CBT for hoarding, there's compassion-focused therapy. So we talked about the mechanism of maintenance. Will someone tell me about CBT for hoarding?
I can talk a little bit about the different components of CBT for hoarding. So one of the things, like we mentioned, is that there can be some difficulties with organizational habits, ways that things are organized. So there might be some organizational techniques that are gone over, thinking about like how do we best kind of categorize things, group them together, where do things need to go, some more of the like logistical kind of training in that way. But really the biggest kind of chunk of what CBT for hoarding focuses on is exposure to the difficulties discarding piece. So what that involves is setting aside a specific time of 30 minutes a day to in session with a therapist, and then also at home in between sessions, go through items and sort them. And a lot of the process, especially earlier on, is reflecting on what emotions and what thoughts are coming up when you are sorting. So thinking about like picking up an item and the fears that are specifically associated with getting rid of that item. If it is, for example, a postcard from a family member, and if I get rid of this postcard, is that like I'm getting rid of my connection to this family member? Am I going to forget what they said to me? Am I going to forget the memories that are associated with the place that we went? So sometimes we can do like more concentrated behavioral experiments where you will specifically test that feared outcome of, if I get rid of this and I throw it in the trash, can I still remember the things that I was afraid I was going to forget? And then there's also, as we talked about, like exposure to not acquiring and doing some of the like more thought-based work through that as well. So those are kind of the different broad pieces.
Does anyone have anything to add?
Yeah, but I think that is a good summary of how the treatment looks. You have exposure and you have the cognitive aspects of it. I think that's how it works. So, and as you said earlier, the motivational part is a part of the process,
right,
all the way along.
Yeah.
And when you're doing that kind of cognitive reflection, as you look at those first couple things you're sorting, do trends start to emerge as to why things are kept? Okay. Yeah. So like people tend to have, is it similar to OCD in that way is what I'm trying to ask, where there is a theme typically of a person's behaviors?
Yeah, I think just even anecdotally working with people who have hoarding, some reasons for saving, right? We've talked about, Nicole did a great job of giving a bunch of different examples of reasons why people might want to save things. And most people have a few that are the most strong or intense for them. And that kind of tend to recur, kind of like, as you said, similar people's themes of obsessions kind of tend to be similar. Or they have a couple of key themes. It does tend to kind of be the same with the reasons people say things.
And in this treatment model, is there, I guess, like, to what degree is there clinical judgment in you as the clinician saying, like, let's say you're treating someone, do you have a threshold of numbers of things that they should throw out or percents of things they should get rid of? And then what if they say, oh, I really want this thing because of XYZ reason, and they give you a reason? Do clinicians then step in and say, well, hear me out?
Well, I love that you asked this question because I think that this can be a barrier to people with hoarding wanting to seek treatment, is that they think that the role of the therapist is to make sure that they get rid of their stuff. And actually, the way that I see my job as a therapist is to be curious about what's coming up. Why do you want to keep this? And my job is not to make sure that you get rid of everything. We all have things that we want to hold on to. We all have things that are important to us that we want to keep. My job is to help people think about, if I keep this, do I really need it? Do I really want it? And if the answer is yes, that's okay. And so I think a lot of the times people see the therapist, or, they'll see the shows on TV of just clearing things out. And that's just like a really harmful approach. And the job of the therapist is to really support the individual as they're working through this and kind of be a teammate in that way.
Yeah, and Kyle, just to your point about, the hear me out, I think a good cognitive behavior therapist wouldn't approach this didactically. Let me tell you what you need to know. I think they would use more kind of Socratic questions to help the patient, the client, think for themselves critically about their own thinking and hopefully, if not arrive at a new conclusion, at least kind of question the way they've been thinking about it, which is what we do in depression and in anxiety, and to some extent in OCD, is this kind of Socratic questioning, which is basically where we know what we're kind of helping the client to arrive at what we want them to hear themselves say, but we're not telling them it. We're asking them questions in ways that will help them to get there, which is an important clinical skill.
Yeah, because there might be like a lot of objects that they are saying like, oh, but no, this one is different. And, that might involve like putting those all like aside and coming back to those later. It's not just going to be, we do one pass. There might be some things that are a little harder, but also, like as Amanda said, that, we want to get folks to a place where they are able to function day to day, and that could look a little different in everyone's home.
Yeah. So HG-1181 asks some really good questions in the comment. You're trying to use CBT to treat irrational hoarding behavior, and as we've talked about, some of these folks have poor insight. How do you all handle it when you kind of come up against that poor insight when you're doing CBT?
Yeah.
So I think like the motivational interviewing is the first part, but we talked a lot about like the trust. Trust is really important in hoarding, because when patients come to, like, I'm not a clinician, but it's been talked and discussed a lot in hoarding literature. When people come to clinicians, like they have heard a lot, you need to discard this, like you just need to get rid of it. So they might be like defensive, and they might think like they are gonna get rid of my stuff as well. And one of the reasons we are like most people coming to clinicians, like sometimes they don't come themselves, they are referred by social services or other parts, because like they're afraid they are going to take my possessions. I know they are going to take. So the first part is trust. So we are going in this way together, and we are going to help each other to build like a maybe more meaningful life. So after this trust, like once like the person trusts the other, like a clinician, it might be easy. And then motivational interviewing, and why is it important to declutter some of the items? Maybe values can be taught here. Like people with hoarding disorder, like they have really like nice like values, like some of them, they say, I want my grandchildren to come over and like play in the just living room or like in the kitchen. So these are kind of values that can be reached with some decluttering, maybe highlighting these things. And I think also like the question was really nice. Like when I approach a pile of like stuff, like a lot of emotion coming up. So it is really hard to start. Like it's like when it's this much emotional, it is really difficult to start. Maybe some emotion regulation, maybe some other techniques. We can start small by small. We are not starting like with all the room. We are just, the first part is like maybe little part of maybe kitchen, maybe other parts. And also like the risk, like the safety risk, which are the areas that are like that have most risk, because like maybe fire risk or other risks. So we want to start with these places as well. So putting up the goals and then starting little by little.
I love the comment about values, which made me wonder, do you guys use any acceptance and commitment therapy stuff in treatment of hoarding? ACT?
There's some really interesting work that a lot of people have, a couple of different research groups have looked at acceptance and commitment therapy for hoarding. And I know they have like an online treatment. I think it's Jennifer Kraft, and looking at some of that. But I think also even CBT for hoarding is, if you're doing it and you're being really intentional about being curious about your client and their motivations, that I think that pulls in a lot of values as well, right? Like I've worked with a client who, she was really wanted to do a lot of research to find out if before she got rid of things were valuable, if there was a monetary value. And we kind of talked about, what do you really want to spend your time on? What is this how you want to spend your time? And ultimately it was, no, I want to be with my grandkids. I don't want to spend my time researching all of these different things. And so I think that even if you're not doing a more formalized form of ACT, which does exist for hoarding, pulling in the values and really connecting that is helpful to ground this therapeutic approach, even in CBT.
Yeah, good point. And ACT doesn't have a monopoly on values work, for sure.
I do want to get to a question Musia asked at 12:46, where she or he said, so is it taking the risk of getting rid of something that could be potentially useful down the road? And as people who treat those with hoarding disorder, I'm curious how this strikes you and how you would respond if a client asks you this.
I mean, I think it would be very similar to, folks who have OCD and are you willing to take that risk? And, can you trust that you'll be able to manage that if that were to happen? In the work that I do with compassion focused therapy, there is a lot about creating a safe place, like a safe therapeutic space, to just sort of, recognize that, okay, yeah, I do have this tendency to get highly dysregulated or to have all these ideas that come up when it comes to going through objects, and that may happen somewhere down the line. But, instead of that sticking as, oh, I should never have gotten rid of that, to just recognize that, to recognize more of the positive aspects of that, that, we can get another one, or that you can tolerate the discomfort that comes. Yeah, if you were to need an object again.
Yeah, I think that is a good way of seeing it. Sometimes there can be ideas that are things we can test out, and that is like, okay, we can see here if it's true or not. But often in hoarding disorder and in other disorders, you come to this point where it's not really something testable in its own. So it's in the end, it becomes a matter of a choice where you are. Am I going to take a chance with this or not? And can I practice to sit in that distress and become better at making this decision, because that's what I want long term. So that also connects a little bit to the value piece you talked about earlier.
Yeah, when I saw that question, I was like, I wonder what the clinicians would think about this. But thank you for humoring my interest. Nicole, I promised that I would also give you a second talk about compassion-focused therapy. And I wonder, is it a different modality entirely, or does it add a layer on to CBT? What exactly is it?
Yeah, so it is its own modality altogether. The founder of it, Paul Gilbert, he initially started by, realizing that a lot of people can be very self-critical of themselves and view themselves, much more negatively than towards others. And my supervisor, Jiang Zhou, she is actually working on a lot of publications about CFT's application to hoarding specifically. And, in a nutshell, compassion-focused therapy kind of blends the elements of mindfulness and self-soothing and imagery exercises, along with, the almost evolutionary biology, the neurobiology of understanding our nervous systems and how, we have evolved to be this way. And now in present society, it can be really challenging to have, maybe a very overactive nervous system, or to experience emotions that, maybe we don't feel like we have as much control on. And I want to say that, compassion-focused therapy really tries to hone in on the stigma aspect of hoarding. Mm-hmm. So, a lot of people come with incredible shame and concern for, new people coming into my space, seeing how I live. And the real emphasis is, that this is, not your fault. That doesn't mean to say that, you can, that doesn't mean that we condone tolerance of it, but that, let's try to work with what we have, and in a way that's a form of self-acceptance, and also being willing to make the commitment to do the work of decluttering. And, that could even that can apply to a lot of other things too, even reestablishing relationships with family members, being honest with yourself. There are a lot of applications. But yeah, I think I'll stop right there.
Mm-hmm. No, but I like there clearly is a shift in focus towards the stigma and the shame around hoarding, which I guess are two words that didn't really come up when you're discussing CBT. So I think there's definitely a value add. We're at 59, but I like to give everyone at least one sentence to say what, if someone has hoarding disorder or a family member with hoarding disorder, what they'd want to take away from the stream. So I'll go reverse order this time to give Ines the most time to think. Nicole, what's one sentence you want people to take away from the stream?
Oh my gosh.
Yeah.
Okay. So I think the thing that I always love is something that I brought up before, that, hoarding behaviors kind of come from behaviors that, all of us naturally have, the collecting, stockpiling. Yeah. And in a way that I want people to think that, even though there are very stigmatizing social media content out there about hoarding disorder, that inherently it does come from behaviors that, we all exhibit.
Mm-hmm. Amanda, one sentence.
I think I would just want people with hoarding to know that there are people that really care about them and want to help understand their experience, and that we're working to try to improve outcomes for people like them.
I think, Dante, you're up.
All right. Then I would like to say to relatives and family members that I know that a lot of you take on large responsibilities and trying to be family members, support, sometimes trying to help with the clutter, trying to do all of these different really difficult things. And it can be really, really overwhelming, and that it's okay to also sometimes take a couple of steps back, and it's not really the same as giving up.
Yeah. Ines, bring us home.
So mine will be a bit like a step further for Amanda's comment. Like, I think, yeah, we have been a bit late to raise awareness about hoarding and try to understand this phenomenon, but there's a growing awareness across the world, everywhere, and there are many groups who are like coming together, even like without clinicians. People who are struggling with hoarding, they come together and they encourage each other, and they are like building up some decluttering buddies, and they just communicate over the phone or other things. So please reach out, please, even if in your city there isn't any like establishment or in groups kind of things, there would be in another city or online. So please reach out. There are many people out there who are seeking help, who are trying to help. So you are not alone. So please get in touch, like or IOCDF or other platforms to know where to go.
Yeah, I like the term decluttering buddies. Well, I have to do medical school things, but thank you all for joining.
Yeah, good discussion, everybody. Thank you.
And yeah, see everyone next month.
Yeah.
Bye. Thank you,
There you go.
everyone.
Bye.